Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Today we're discussing the benefits of taurine and amino acid on your heart and your blood vessels and your blood pressure. So taurine is a very unique amino acid. Now normally you eat protein and it's broken down into its amino acids. That's what protein is made out of. And these amino acids we arrange in various chains in different combinations, and we use that for creating the structure and for the function of our organs and systems in our body. We're basically made out of protein. For instance, amino acids are combined to create enzymes. Enzymes make the body work more effectively and efficiently and faster. Amino acids serve as individual neurotransmitters, such as ALCAR for memory and brain energy, or glutamate and GABA for learning. Amino acids are combined to make some hormones, such as growth factors like insulin type growth factor 1, or to create insulin itself, but also to create structural components of the body. So there's a lot of amino acids to make our ligaments, our tendons, our bones, our joints, the joint tissue, like the cartilage on the end of our bones, our hair, skin, and nails, etc. But taurine is different. It's not combined with other amino acids. It works alone. So, hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health, which indicates that we do have a scientific department which is made up of nutritionists, naturopathic doctors, clinical nutritionists, naturopathic doctors, dietitians, etc. And you could contact them. You could come in and meet them in our stores. You could call them on the phone. You can send them an email. Let me give you an email address before we get started. This goes to 5 of our nutritionists. nutrition@invitehealth.com. These are very kind, extremely well-educated people who want to help you. They really care. So getting back to the episode, we're talking about taurine here and its effects on your heart, your circulatory system, and your blood pressure. Taurine, what is it? It's a free amino acid. It's a sulfonic amino acid. It's found in many tissues in our body. For instance, we use it to make bile salts. Bile salts break down fats from our food so we can absorb them. We also use taurine to detoxify chemicals in our kidneys and our liver to rid the body of chemicals. Taurine plays an important role in the functioning of our heart, our muscles, our eyes, our brain, and cells called platelets, certain blood cells called platelets, which are involved with blood clotting. So where do you get taurine in your diet? Well, the dark meat of poultry like chicken, but also fish, that's where I get it from, shellfish like mussels, but also eggs, they're good sources of taurine. But you can also make it. You can synthesize it in your body out of a commonly consumed amino acid called L-cysteine. Now, because of this, because it's mostly found in meat, fish, and eggs, vegetarians and vegans can have low levels of taurine. When I do have from time to time a vegan contact me and say, hey, what am I missing from my diet? And I go over certain nutrients that we get from not animal sources that they can use in their diet to make up for that. Otherwise, their energy can suffer and their memory can suffer. So it is important. Now, so taurine is one of the things I often recommend to vegans and people who are mostly vegetarian. Now, taurine is guilty by association because they often use it in energy drinks. But taurine is not a stimulant. So it gets a bad rep because it's in energy drinks, and energy drinks are patently absurd and unhealthy. But they use it in there to protect you from the jittery effects of excessive caffeine intake. So they actually use it because it's good for you and it helps prevent the drink from harming you. Sadly, once again, there's guilt by association because taurine is actually extremely beneficial for us humans and our human body. Now, a lot of data from all over the globe. I remember the World Health Organization studied 60 different population groups in 21 different countries numerous times. Taurine helps lower the risk of developing heart disease, clogged arteries in the heart, that's the biggest killer in the world, or suffering from a stroke or a heart attack. Taurine also protects us from developing various kinds of conditions, such as diabetes and kidney damage and nerve damage. So studies performed on overweight people or obese people, clinically obese, like they're in danger, their health is in danger because they're so overweight. Taurine may reduce their triglycerides. That's one of the fats in their blood that can trigger a heart attack and blockage to the arteries, or other lipids like cholesterol. Taurine may improve their lipid metabolism. But it also stimulates the release of adiponectin. Adiponectin is released. It makes you feel full. It helps protect you from inflammation. It helps protect you from developing diabetes. So it's a good guy. Taurine has been shown to decrease inflammation and work as an antioxidant in people who are overweight or obese. And in fact, in diabetics, it may help reduce their risk of developing the kidney damage you see in so many diabetics, diabetic nephropathy. Taurine may also help manage muscle cramps in patients who have chronic liver disease. Now, for the brain, taurine does a lot of things. It seems to improve brain function in people with dementia, mild to moderate dementia. It reduces the risk of stroke in patients with certain genetic disorders, but also in the general population. Taurine actually serves as a neurotransmitter in the brain. It gets into your brain very easily. When you take taurine as a supplement or from food, it crosses the blood-brain barrier. By active transport. Things actually carry it into your brain. So let's explain that. Your blood vessels throughout your body have some insulation to prevent things from exiting the blood vessels and getting into the body. That's like a protective mechanism. In the brain, this is more so. There's extra insulation in the blood vessel walls in the brain. It's called the blood-brain barrier. And this is meant to prevent bad things from leaving the blood vessels and getting into the brain. Taurine can cross this very easily, and it's used as a neurotransmitter in the brain to calm down the brain. So taurine actually protects the brain from excitotoxicity. For instance, glutamate, like MSG, monosodium glutamate. There's like a whole bunch of different names for that, like texturized protein and texturized wheat. But glutamate, if you have excess levels of it, overexcites the brain and actually burns out brain cells. It works them to death. Taurine helps prevent that. And it works, by the way, by controlling calcium ions. It's kind of like a natural calcium channel blocker. Calcium is great. You need calcium to build solid bones, and 99% of your calcium belongs in your bones, but it's that 1% that's so important that's floating around in the bloodstream, because you need that for the heart to function, for your muscles to function, for your nerves and brain to function, and for energy. But when it's not controlled properly, these calcium ions can trigger increases in blood pressure. So taurine prevents that from happening as a natural calcium channel blocking type of nutrient. It's also anti-apoptotic in your brain. In other words, it helps prevent overexcitation in the brain from killing brain cells. Anti-apoptotic means it prevents the death of. Now, taurine improves the health of your heart, and that's where we're going with this episode. Taurine is a conditionally essential amino acid. That means you can usually make enough to meet your body's demands. Whatever your body needs, you can make enough for your retina and your heart and your brain and your muscles, etc. But under certain circumstances or within certain disease states, you cannot make enough to meet the demands of your body, so supplementing becomes really important. This is true in people with high blood pressure. It's also true in people with congestive heart failure. It's true in people with liver conditions, people with kidney disease, people with damage to their digestive tract, and diabetics. Now, studies show that taurine reduces blood pressure in people with hypertension, which again is our focus today. It reduces pressure by decreasing the levels of plasma epinephrine. Epinephrine is also known as adrenaline. A lot of people call it adrenaline. It's the fight or flight neurotransmitter. So when you release epinephrine, it squeezes your blood vessels and makes your heart beat faster, and that raises your blood pressure so you could get away from danger. So one of the ways that taurine seems to work is by blocking excessive release of epinephrine, but also as a natural calcium channel blocker, as I explained a minute or two ago. Now, taurine helps reduce the risk of developing heart disease, plaque buildup, the cholesterol waxy plaque buildup in your blood vessels. So let's explain what that is. When you have cholesterol plaque buildup in your arteries, it's kind of like when you burn a candle and you get those drips of wax coming down. It's like crispy on the outside and mushy on the inside. Well, that could become very unstable, first of all, and break and lead to a heart attack or stroke. That's called plaque vulnerability. But also it stiffens your arteries and it narrows your arteries. So therefore, to get blood to the brain or the legs or your muscles, the heart has to pump harder. That's high blood pressure. So one way that it helps protect your heart is by helping reduce a buildup of cholesterol in your arteries. And the research really links taurine to significantly lowering your risk of dying from heart disease, but also from suffering with a stroke or heart attack. Now, by the way, taurine seems to work very well with the addition of the mineral magnesium for heart health and for blood pressure control. So here are some studies. In a 2-week study of people with diabetes, not a long time, taurine really helped reduce the stiffness of their arteries. Now that's important. Let's explain what's happening there. If your arteries are stiffened and narrowed, to get blood to your legs and your brain, etc., your heart has to pump harder. That's high blood pressure. So if you could reduce the stiffness and the blood vessels become more resilient and elastic, it's easier for the heart to get the blood to your feet and your brain and your organs and your systems and your muscles, etc. That's normalizing blood pressure because the heart doesn't have to push hard. Blood pressure goes down towards normal. So this potentially made it easier for the heart to pump blood to the brain and the feet and the rest of the body, and it improved blood pressure. So here are studies. This is kind of like a schematic of what taurine does for you. It's the Canadian Journal of Physiology and Pharmacology. It's a couple of months ago. It's the year 2020. It's from the University of Sherbrooke up in Canada. And they said a very vast literature, so they're saying numerous studies, reported beneficial effects of taurine in hepatic dysfunction. That means problems with the liver. For gastrointestinal injury, repairing the digestive tract, kidney diseases, protecting the kidneys, diabetes, and cardiovascular diseases. Most of these effects were attributed to its modulation of calcium homeostasis, as well as its antioxidant activity. So in other words, many studies are showing that taking taurine in people with liver disease, heart disease, kidney disease, diabetes, damage to the intestines, helps with their health, helps improve their health. And this has to do with regulating calcium, like I said before, a natural calcium channel blocker. So here's the Center for Hypertension and Metabolic Disease, Dapong Hospital, which is in China, plus a whole bunch of other academic research institutions in Asia. It's in the journal Hypertension, and it's 120 patients with high blood pressure. They gave them taurine 1,600 milligrams every day. That's a little over 1.5 grams. Or they gave them placebo for 12 weeks. It dropped their systolic blood pressure by 7.2 points on average, and their diastolic blood pressure by 4.7 points on average over a 24-hour period, and it restored vasodilation. So what does that mean? When you look at blood pressure, you see a figure like 120/80, which would be considered normal blood pressure. 120 is systole. That's when the heart is actively pumping out blood, which it does over 100,000 times per day. The bottom figure is when the heart is refilling, so it's getting a little rest. If that bottom figure in your blood pressure reading is elevated, that's very dangerous. That really increases the risk of throwing off a blood clot, having a stroke, or damaging the heart. So it lowered the top figure in blood pressure a little over 7 points, and the bottom figure in blood pressure by about 5 points. That's actually an excellent result. And the beauty of it is taurine does not force blood pressure down. It helps restore it back to normal, so you can use it safely with your high blood pressure drugs because it cannot cause low blood pressure, which is called hypotension. It cannot do that. And it restored vasodilation, the ability of the blood vessels to open and close appropriately as the heart is pumping blood. So it really is an excellent supplement, and it's extremely safe. Because the studies use 1 gram, half a gram, 6 grams. The dosage is all over the map. But I generally see that about 1.5 grams a day is great for your blood pressure. So here's the journal Amino Acids. It's Texas Tech University Health Science Center down in Lubbock, Texas. That's up in the Panhandle. And they said giving taurine as a supplement has been studied extensively for high blood pressure. Now I'm paraphrasing. They actually said as a hypotensive agent. The beneficial effects of taurine were also demonstrated in studies involving subjects suffering essential hypertension. Taurine supplementation for as little as 7 days resulted in measurable decreases in high blood pressure in these patients. I mean, that's saying a lot, okay? So here's the School of Health, Sports and Applied Sciences, St. Mary's University in London. It's the journal Current Hypertension Reports, and they're looking at a group of studies on taurine. So they start off by saying there's a growing body of evidence that taurine deficiency is associated with hypertension. In other words, a normally healthy person, if they're not making enough taurine and getting enough taurine from their diet, their blood pressure could go up. So they put together 7 peer-reviewed human clinical trials, and taurine reduced both figures in blood pressure, the top figure and the bottom figure by 3 points on average in the general population. So in other words, if you don't eat enough food with taurine, your blood pressure could go up. Giving these people taurine brought their blood pressure back down to normal. That's what it means. So it has a relevant effect on blood pressure across the globe. In other words, for general health policy, it's important for people to include taurine in their diet to help regulate their blood pressure. And it's really safe. It has clinically important effects on high blood pressure. It's extremely safe. So here's taurine may provide heart health benefits. Now this is a study in women, and it was protecting women against heart disease. These are women with high cholesterol. It's the European Journal of Nutrition. By the way, it's NYU in New York City. It's New York University. Professor Chen in NYU. Here's what he said. Our findings were very interesting. Taurine does not seem to have a significant... I read it wrong. Our findings were very interesting. Taurine does seem to have a significant protective effect in women with high cholesterol. This is Dr. Chen. He was the lead investigator from NYU. And they found that if they gave women with high cholesterol who had a risk of developing heart disease taurine, it significantly lowered their risk of developing coronary heart disease. In other words, it was helping prevent hardening of the arteries, which is the #1 killer on planet Earth and in the United States. So here's another one. These are researchers from Ireland. It's the Royal College of Surgeons in Ireland. And they found that in smokers, now obviously I don't want anybody to smoke. It's one of the worst things you could do for your health, maybe the worst thing. Giving smokers taurine prevented hardening of their arteries. Now that's the cause of dementia, that's the cause of stroke and heart attack in people who smoke, hardening of the arteries. So giving them taurine was preventing hardening of the arteries in smokers. They gave them 1.5 grams to 2 grams a day. I mean, that's pretty significant. Here's the last one I'm going to say. This is the University of New England in Australia and a couple of other academic research institutions in Australia and in England. It's in the journal Sports Medicine. It's a meta-analysis of human clinical trials, 10 peer-reviewed human clinical trials, 10 studies. If they gave people taurine, it improved their endurance with exercise. It could have been an acute dosage, in other words, just giving it one time before they perform, or they could have been taking it every day, which is called chronic supplementation. So simply giving taurine improved the function of the heart and the blood vessels and the muscles during exercise. So it's safe to say taurine helps reduce your risk of heart disease by improving several key risk factors, such as your cholesterol and your blood pressure, and this helps reduce vascular inflammation and vascular stiffness. And you put that all together, and that's key to reducing your risk of heart disease. That's improving your Framingham risk score. Your Framingham risk score is your risk of developing a stroke or a heart attack over the next 10 years. It reduces your risk of developing a stroke or heart attack over the next 10 years. A good reason to eat your salmon and your cod and your halibut and your mussels. Or even if you just take 500 milligrams of taurine every day, it'll add to the amount you're getting from your diet, and it'll be sufficient to help protect your heart and your blood vessels for normally healthy people. So in any event, thank you for tuning into the Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts, or you can visit invitehealth.com/podcast. Please subscribe. Please leave us a review. You can also follow us on Facebook, Twitter, or Instagram at Invite Health. And I hope to see you next time on another episode of the Invite Health podcast. Thank you so much for listening.